Hi, so this is Emily Drolet, and I did my disability pamphlet on oppositional defiant disorder, ODD. So I'm going to kind of summarize my pamphlet in general. So I try to use a lot of bright colors and pictures because I'm a visual. I really like visuals. I like things to be colorful and bright. It keeps my attention. So I try to do that just to keep the attention of parents and teachers reading the pamphlet or going through the resources. So overall, over here I have the characteristics of oppositional defiant disorder in children. Some characteristics are struggle with self-soothing, moody, loses temper, irritable, blames other for their mistakes. They can be touchy, struggles with concentration, defiant, refusing rules, uncooperative, trouble sleeping, and unkind to their peers or adults. Down here I did put a little section, it's called important to note, and I just put little facts that I think teachers or parents would want to know. So ODD symptoms usually start around the preschool years, and children with ODD may have a coexisting condition with ADHD. That's pretty common to have a coexisting other diagnosis. And then children who have experienced trauma or a lot of stress as a toddler are more likely to develop ODD symptoms. And over here in the bolded, I have it's more common in boys than girls, and the child must show extreme behavior and or symptoms for at least 6 months. That's really important to know because overall, 2-year-old, 3-year-olds, they may have a moody day or they may really struggle with concentration. So this is important to note that this is for 6 months and it's to the extreme. Parenting can also impact oppositional defiant disorder as well. And also different multicultural parenting ideas or strategies can impact oppositional defiant disorder on top of just parenting in general. So then up here I have services provided. So there's early intervention for the child within the preschool and preschool programs and in-home ECSE programs. There's also in-home behavioral therapy, individual therapy, family therapy, and social group skills for the child. Down here I have medication. So it's important to note there's not just a general medication for ODD, but there is stimulant medication that can be used if the child is showing impulsive behavior or has ADHD, but it's not used alone just for oppositional defiant disorder. Behavioral therapy is commonly used for children with oppositional defiant disorder to really focus on the behaviors and interactions. Antidepressant medication can be used as well if the child has anxiety or depression. Treatments are based on age and the severity of symptoms, and medication is based on another coexisting condition and not just oppositional defiant disorder alone. So then on the second page, I have how is it expressed from birth through age 5 across development. So some general points is the child may struggle with relationships with their peers and adults. That could really be hard for the child as a toddler or preschooler to make friends and keep those interactions with their friends. Which that also could go with trouble communicating with others, and that could be because of the interaction. So they may have a hard time letting out their frustrations or interactions with fears, having that conversation with their friends, and maybe struggle with communicating in general with their language. The child may have trouble calming themselves down by themselves. They may be dependent on a teacher or parent to help them calm down. Impulsive behavior and maybe aggressive towards peers, adults, and teachers. And then up here I have teaching strategies, different strategies a teacher could use to include the learner with the same peers in the classroom. So one of the big things is to use positive reinforcement. Children with oppositional defiant disorder really interact and work with positive reinforcement versus negative, and going with positive reinforcement using a reward system could be really helpful with these children. And you could also use that for maybe interactions with a peer, like if they talked kindly with a peer or had a good conversation, they could earn a sticker or a point. That's one idea. It's also important to give children with oppositional defiant disorder choices. They work better when they are able to pick, do you want blue or red marker versus you get the blue. That kind of gives them like they feel like they're a little bit in control. It's also important to give the child the option of taking a break when they're overwhelmed. So you could have a calm down chair placed in your room for the child to sit, maybe some stuffed animals or fidgets they can use to calm down. more time for the child to complete tasks and assignments. This could be when they're older, but you could also do this in preschool for maybe a small group activity. Also, the use of visuals and reminders of daily classroom rules for the student, and a structured classroom is important. Over here, I just put a little quote that says 67% of children who are diagnosed with ODD and receive treatment will be symptom-free in 3 years, and this is from the American Academy of Child and Adolescent Psychiatry. So then down here, I have some resources for parents. I have 2 books that would be really good for parents with a child oppositional defiant disorder. I also have 3 websites. So the first one's more focused on just what ODD is and parent strategies and just information about the disorder. The Very Well Mind is information regarding aversion therapy, which is an alternative procedure and how that's used. It's not that commonly used anymore, but it is just an idea for parents to look at. And then the last one is Center for Family Involvement, which is a multicultural parenting idea and support where it helps with multicultural parents and getting different ideas for how to work with children with behaviors. And then I did put one support group, which is the Daily Strength Support Group. And this is support group specifically for parents with children who are diagnosed with oppositional defiant disorder. And then here are my reference right here. So that is my pamphlet. Thank you.